Well, to give you an example, we were looking at mortality in England, and we looked at mortality before the age of 75, so-called premature mortality. You see a gradient. The higher the education, the lower the mortality. And then we said, if everybody had the low mortality of people with a university degree, we would potentially prevent half the premature deaths, 202,000 deaths every year. So it's huge. Now, your question about, well, is social position more important than pollution or smoking or other things? Part of the reason that social position is linked to mortality is that the lower the social position, the more likely are people to smoke. The more likely are they to be exposed to poor environmental conditions. So in other words, where you are in the hierarchy changes the frequency of exposure to known risk factors for disease. They may be behaviors like smoking, poor diet, lack of physical activity. They may be environmental exposures like air pollution, poor environmental quality, poor housing. But it's where you are in the hierarchy that's key. And that suggests two potential strategies for reducing inequalities in health. One is to reduce the social and economic gaps between top and bottom. And that means economic policy, fiscal policy, for example. And the second strategy is to understand what links your position in the hierarchy with your risk of ill health and intervene on that. You get on the Jubilee line, the underground line at Westminster Station where the Houses of Parliament are, and go east. For each stop, you go east, life expectancy drops 1 year. I was at Westminster Station. I told a colleague this. He said, well, let's go west. But in other words, within cities, you can find these dramatic differences, short distance apart, but you can see it. If you cycled with me around Westminster, you can see the difference between the rich parts and the middle parts and the poor parts. And then the question is, well, yeah, but it can't just be the appearance of the city that causes these differences in health. What's going on? And we said there were 6 domains that were responsible for the inequalities in health that we see, and where potentially there should be action to reduce them. Early child development, education and lifelong learning, employment and working conditions, having the minimum income necessary for a healthy life, simply having enough money so you can lead a healthy life, healthy and sustainable places in which to live and work, and what we more traditionally think of under the rubric of prevention, smoking, obesity and the like, but taking a social determinants approach.